Hi, my name is Bisen, and I'd like to present Virtual Global Health through Longitudinal Case-Based Rounds, a bicontinental medical education pilot program. I'd like to give a brief thank you to the Robert J. Havey Institute for Global Health and our preceptors, Dr. Melisant and Dr. Olstrup. The conception of this pilot program began during the confines of the COVID-19 pandemic, as the medical education curricula for schools across the globe was transferred to online platforms. Due to the travel bans and general limitations placed on travel, medical students were unable to access and take advantage of global health opportunities that they had access to in the past. This can be seen by the map on the right, as many countries limited their exposure to COVID-19 by closing their borders. As exemplified by the COVID-19 pandemic, there is a global need for countries and communities to have physicians who can navigate emerging health issues, whether it's creating global policies to combat current issues or preemptively addressing future health issues with cross-cultural unity. The goal of this study was to bring together international cohorts of medical and PA students to confront travel restrictions, time restraints, and cost barriers to provide global health exposures in the face of the pandemic. The program's virtual, case-based format moves medical education closer to the general call for virtual care implementation. The goal of the program was to provide American and Tanzanian medical and physician assistant students with a longitudinal global health experience through online interactive sessions with intentional bidirectional collaboration. Our cohort engaged in bi-weekly meetings using live video conferencing, where students discussed patient cases representative of cases seen in outpatient primary care clinics at their home institutions. Students would work together to discuss the patient's history, physical exam, and labs in order to arrive at a group-determined differential and final diagnosis. Now moving on to the methods. The project design included 6 medical students from the Northwestern University Feinberg School of Medicine and physician assisting students from the Rural Aid Organization Hospital in Shirati, Tanzania. Both cohorts were led by attending physicians from their respective countries. The program began in December 2021 and concluded in April 2022. The pilot program's efficacy was assessed through anonymous qualitative surveys using a Likert scale in order to assess student growth, global health interest, and skill acquisition. Here we can see a logistical design of the study. As indicated prior, the 2 international cohorts would work through case-based sessions using live video conferencing. Both groups would have presentations prepared that would be shared using devices such as TVs, computers, or phones in the other country. Now moving on to the results. Although our analysis was limited by the size of our cohort, there's still important analysis that can be gleaned from the responses submitted. The first is that students indicated that they experienced a decrease in burnout as the pilot program progressed. They also reported an increase in the global health experiences that they had encountered, along with an increase in the knowledge of healthcare limitations and benefits in resource-limited countries. And they finally reported an increase in the primary care patient presentation proficiency, specifically when creating a differential assessment and plan. When discussing the benefits of this program, the first thing we need to discuss is the sense of community and mentorship felt by students, as older students from both countries provided younger students with points of guidance. The other aspect that was beneficial for younger students was their early exposure to oral presentations, a skill taught much later in medical school and in PA school. Students were also exposed to variations of practice, as students in Tanzania were exposed to common medical practice and/or conditions in the United States, and vice versa. Along with this, students were also exposed to different medical training approaches, health system policies, and general practices, along with site-specific goals for medical training. There seemed to be many other avenues that this program could offer, as we could move to medical language proficiency in non-English speaking countries, complements to in-person experiences, and also provide global experiences for students who are unable to travel, whether it's due to cost or any other restrictions. As we continue to discuss the efficacy of the program, we need to discuss some limitations that we encountered so they can be optimized for future implementations of the programs with new cohorts. The first limitation to discuss was the general timeline, as the program, which began in December 2021 and ended in April 2022, fell during the M2's USMLE Step 1 preparation time. This curbed their involvement at the time, but did help in their general preparation. Another limitation we encountered were technical issues that occasionally decreased the ability for the groups to get in contact. In conclusion, we deployed an international virtual global health experience for medical and PA students in Tanzania and the United States. This program is unique in its bidirectionality, as students and attending physicians from two countries directly communicated and worked through case-based sessions provided from the other country, in opposition to traditional lecture-based global health courses. We were able to work past travel restrictions during the COVID-19 pandemic by transitioning global health experiences to the virtual setting. And this program can be easily implemented after countries ease restrictions as well. This model will increase the prevalence of global medical education by eliminating travel, cost, and time barriers, allowing for efficient and effective global health experiences throughout the medical education continuum. Here we can see an example of a live case-based session, where we can see students and physicians discussing and contemplating a specific case. Here are my references. I'd also like to give a thank you to the Robert J. Havey Institute of Global Health at the Northwestern University Feinberg School of Medicine, along with Dr. McGarry and Dr. Ulstrup for their care and guidance. Thank you so much.